Recent work has shown that there's about 50,000 public health employees needed at the local level, and that's across the country. So there is an urgent need to develop future public health workforce across the country.
My name is Abby Rose, and I am a Master's of Public Health Nutrition student at the University of Minnesota, and I'm in a program that is a coordinated program, so I'm also a dietetic intern. I spent 9 years teaching physical and health education, and so I think for me it made sense. It went hand in hand with teaching physical education because nutrition is just as important as physical activity.
I'm Addie Ingebretson, and my title is Program Coordinator.
Bloomington Public Health was one of the first to have an AmeriCorps member. That opened the door for us to realize how incredible it was to bring in AmeriCorps members. And one of the newest parts of AmeriCorps is the Public Health Corps.
So when I started out with AmeriCorps, they had various sites we could pick from, and Bloomington had a lot of projects that piqued my interest, including one that involved focus groups around COVID, so I selected Bloomington for that reason. I've gotten to work in a lot of different areas. I've been helping with a lot of the population health team. That includes their work on housing and also their beginning work with groups who are tied to opioid prevention. I've also gotten to work in emergency preparedness, as well as working with some people over on the transportation side to talk about how housing is tied to health.
One benefit of my program is that our director matches us or places us. She takes into account our personalities and our interests, and she placed me here, and so far it's been a great fit.
Well, mostly they're coming to observe what WIC is as part of their schooling. It gives them an opportunity to find out what dietitians do in the public health world. And then as part of their time here, they do various projects. A variety of different resources have been developed for us by the students.
One of the values of having students or early career professionals is the wide variety of experiences. So we get students from other local colleges in the area, along with our Public Health Corps members, getting this broad breadth, whether it's working in WIC, seeing how we work with data and process information, to thinking about how we change systems and how health impacts every aspect of city government. They're interacting with colleagues from around the city, looking at how do we create that enduring, remarkable community where people want to be, and that health is at that forefront.
I think AmeriCorps, and specifically the Public Health Corps, is really valuable because public health work is extremely broad, and so being able to work in public health in a shorter time frame allows people to get their feet wet and have some idea of what this field is like without having to commit to a long-term position, and shift oftentimes from having an academic background to getting some real boots on the ground experience.
I think it's been very eye-opening because everyone's in different places, and so you never know what resources families need. So just being well-equipped and knowing that there are a lot of services out there to help families, you know that you're making a difference, and so that's just been really inspiring.